Hello, everybody. For lab, right, we're going to be getting into the digestive system, right? Again, this is going to be a little bit different of a format, right? Obviously, with all of these things going on with the pandemic and whatnot, right, we've had to kind of switch from a face-to-face in-class delivery to more of a, well, not more of a, to a remote, style of instruction. So right, one of the things to kind of be aware of or to be careful of is to not feel so uh, not isolated, but to not feel like you are doing this entirely on your own, right? Because of the situation we're in, yes, we're forced to do class like this. However, as I had mentioned, right, I will be doing Zoom sessions for office hours. So if you ever want to, meet one-on-one via Zoom, we can absolutely do so, and I suggest we do so. That way, we can still cover any questions that you have and that sort of thing. If you start getting flustered or frustrated or confused, or you know what, I'm struggling with whatever happens to be, just shoot me an email. Just reach out, right? I mean, we're all kind of, here in the great state of PA, we're kind of all, well, granted, we're not quarantined as of yet. However, we all have significantly more time on our hands with all of the things we can't go and do. So, shoot me an email and I'll more than likely respond pretty quickly to it, right? So this, first topic we're going to get into, this is the digestive system, right? Digestion and metabolism, that's the next thing you should be getting into in lecture as well. But when we think about digestion, right, when we think about metabolism, your metabolism, just a Cliff Notes version, that's essentially the sum of all the chemical reactions in the body, right? Some chemical reactions produce energy, some use energy, and so the end net of them, or whatever's left, that's, whatever's utilized, that's the metabolism. And so why is it we actually consume food? Right, yes, there are nutrients in the food that we eat, absolutely. And certain nutrients, certain chemicals, certain molecules are required for a number of different chemical processes. But the other part of that is, in order to get that nutrient or that chemical, in order to be able to actually absorb that into the body, we have to first break it, or break the food down, right? You can't just take a bite of a cheeseburger and then all of a sudden that cheeseburger just like somehow goes from your stomach and then inserts itself into the bloodstream. No, there's tiny microscopic little molecules, right, which have to be basically kind of, the burger or the fries or the food has to be broken down to a size that's actually small enough where it can travel through the intestinal wall, for instance. Right, think of a screen, right, a window screen, right? If you had an ice cube, does the ice cube fit? Nope. So you can do one of two things. You can smash you know, the ice cube up with a hammer until it's in small little tiny, chunks of ice. Some of them might fit through, but really, for the most part, they're not going to fit through. So what else can we do? Well, we can dump hot water on them to help melt, or we can add an enzyme, or we can add a catalyst, or we can add something like salt to the ice, right? When that happens, that's going to help increase, that's going to help melt the ice. Therefore, then eventually the ice converts into water and the water can seep down through the screen. Kind of the same idea with our digestive system. And to do that, right, there's a number of different structures, there's a number of different features which kind of help to promote that. And again, they begin all the way up in at the level of the mouth, right? From the mouth with the teeth, our teeth act as this kind of mortar and pestle, right? They help to kind of grind up, pulverize the food, right? As we kind of travel down, right, the GI tract, right? If I'm a cheeseburger, or if you're talking about cheeseburgers, I don't know why. Put the food in here, right? It's going to travel down the mouth, down the esophagus, eventually into the stomach, course around the small intestine for a little while, right? Then eventually enter into the large intestine, across the transverse colon, down the descending, and eventually anal canal, etc. Right? Then defecation. So the entire course of that food, right? There's a number of different secretions. There's a number of different enzymes, right? There's a number of different molecules which are added to that food along the way to help further digest that food. And again, that just begins way up here in the mouth, right, with the teeth. So again, that's where we're going to, simply begin. On the next slide, I forgot. Yep. Okay. One of those days. Good. This here, again, this was just kind of whereas the first image is an actual kind of hand drawing, this illustration is just simply of a, actual gross cadaveric model. Just something to kind of show you how jam-packed the organs are within the abdominal cavity. Right, we can see small intestine all in through here. These are all small intestine, all in through here. Right, they kind of form the middle of the picture. Right, the outside, right, you can't see it down here, but up and through here, right through here, where the large intestine begins, comes up, and we can see it come across this way. Right, we can see it again here, and it kind of forms this frame surrounding the abdominal cavity. Right, again, that's the large colon. This is all small colon, right, or small intestine, excuse me. Right, we have liver up in here, stomach, right through here. You can just see a little bit of it. Right, here's the gallbladder. Right, so things are very densely packed within the abdominal cavity. So, right, this kind of image, as I mentioned, right, the entire course, the entire way through the GI tract, the entire purpose is to absorb the nutrients from that food. That's the end goal. That's the end game. That is the purpose of why we eat food, right? Is to absorb the nutrients from said food, right? And you can see from eating it to the various secretions of the different hormones and enzymes to the actual movement of that food to digesting of it, absorption, and eventually the elimination or the defecation of the food. Now, when we think about the kind of the movement, right? So when I ingest the food, right, as it travels along the GI tract, so if I back up for a second, as I ingest the food, all right, I'm eating it. Awesome. Even before you put that food in your mouth, just simply smelling that food, or seeing that food, or hearing that food, which you're like, the hell's food make? What sound does food make? If it's whatever, you're cooking on cast iron, that sizzling sound, right? All of these different things, right, kind of can initiate certain phases of digestion, something called the cephalic phase. That basically the kind of the precursor to actually eating the food. It's why you can see something and you start salivating. You're like, oh man, I'm hungry. And the reason why that happens is because, again, food was not always this abundant, right? The fact that you can pretty much, go anywhere, and be within, a mile of food. I mean, right? I mean, if we were on campus, I mean, in the lecture hall, I can think of, 4 different vending machines which are within 100 yards. So, I mean, there's food available everywhere, which was not always the case, right? Generally, food was consumed. I mean, sometimes it wasn't consumed on a daily basis, right? Thousands of years ago. So if you came around food, the idea was that you were going to consume said food. Hence the reason why that digestive phase occurs. We start to have these different secretions even before the food is actually put into the mouth. Then once the food's actually put into the mouth, great, we chew it around. All right, well, as I'm chewing food, we want to secrete saliva from the parotid gland, the submandibular, sublingual, right, from these different salivary glands. We want to produce and secrete saliva into the mouth. Right, we want to mix and mingle. That's really the primary purpose of the tongue, is to move the food around to make sure that the food gets coated with the saliva, therefore all of the different digestive enzymes like amylase and something called lingual lipase can start to break down those particular molecules in the food. Now, when we swallow, all right, the food goes down the mouth, down the esophagus. All right, so when that happens, right, as it's moving further down the esophagus, what actually regulates that? Okay, there's a process something called peristalsis. Peristalsis. That's uh, when we think of skeletal muscle contraction, right? Think of the biceps brachii, right? That flexes the elbow or it bends the elbow. Peristalsis, when we talk about these hollow muscular tubes, right? Like the esophagus is a tube, right? And it's surrounded by muscle. When that muscle squeezes, right? As it squeezes, right? It starts from the top, and as it squeezes and contracts, it squeezes from the top down. So when that happens, that propels the food down eventually into the stomach. Again, that's called peristalsis. Well, this has to be regulated, right? We have to have, well, let's back up, right? If that food's going to going to dump into the stomach, there has to be a number of different gastric secretions already present, right? We don't want the food to end up, to enter into the stomach, and all of a sudden, the stomach is like, whoa, what's going on here? Oh, there's food here. We should probably produce some different digestive secretions, different gastric juices like hydrochloric acid and different hormones like gastrin. Those things should already be there, right? So there's a couple of different groups of nerves which kind of function together to synchronize to make sure this movement is occurring like it's supposed to. And that's where we look at, again, when we look at this right here, the submucosal. Oh my God, that was supposed to be a straight line. Yep. Right, oh my God. Why is that so hard? Good Lord. All right, going for the gusto, number 3. Hey, there we are. The submucosal plexus, right? When we come down here, we see all this kind of yellowing, webbing meshwork. This is essentially the group of nerve, the submucosal plexus. We haven't covered the specific parts of the GI tract yet, but the submucosa, all right, the submucosa, that's all in through here, this kind of whitish thing, right? This whitish layer here, that's the submucosa. Right? We see glands, right, in the submucosa, right? Yeah, there's a number of different secretions, right, from the different glands. What regulates these secretions is the submucosal plexus, or again, the plexus of Meissner, right? All right, so we want to make sure that the food is arriving when the food is arriving to the stomach, or if the food is traveling through the small intestine, we want to make sure that the appropriate secretion is there to greet said food. So the other part, so if the submucosal plexus, that's what regulates the actual secretion. All right, now what actually regulates the movement? Well, that's right here. Right? That's the myenteric plexus. Again, right? Think of myo. I'm not even going to attempt to write myo. I probably should, just to see how I can do it. Right? Think of the prefix myo. That's not bad. Yeah, I'll take that all day long. Think of the prefix myo, muscle. So myenteric muscle plexus. Oh, this is the plexus which regulates the muscle movement. Right, you see these layers here? All up and through here, all up and through here. Right, all these different layers of muscle. Right, there's 2 different layers. Circular layer as well as the longitudinal layer. But these two muscles, or these two layers, are going to help regulate the actual movement of the food, right? So if I back up how I mentioned, let me get this off here. As I mentioned, right, the peristalsis, right, the esophagus, right, when we swallow from the top down, right, the esophagus is essentially going to pinch. So the circular layer, which surrounds the entire esophagus, constricts, right? So therefore, as it constricts, come on, mouse, here we go. As it constricts, right, the diameter of the esophagus, those were absolutely horrible arrows, right? The esophagus, or the diameter of the esophagus is going to narrow. So when that happens, the food can't backtrack up this way. Right? So great, the food stopped here, but how do we get it to actually go down this way? And that's where the longitudinal layers come into play. Right? The circular layers merely kind of pinch the food off in this area. The longitudinal layers then actually contract to pull that, think of it as kind of like pulling the pinch, right? They pull that food down the length of the esophagus. Now, it doesn't only occur in the esophagus, right? A peristalsis in the intestine, the small intestine, the duodenum, the jejunum, the ileum, the large intestine, all of these different structures or organs in the GI tract perform peristalsis. Right. And again, we see the two groups of nerves which function to regulate that. Again, one is here, the myenteric plexus, and the second one is here, the submucosal plexus. All right. Some other things, yeah, the mucosa associated lymphatic tissue or lymphoid tissue. We'll look at that a little bit later on, especially down towards the lower portion of the small intestine, throughout the ileum. There's a number of different reasons, right? We think about lymphatic tissue, you want to think about immune tissue, right? Immune tissue or immune system, right? Our immune system, that's what protects us against pathogens, So the lumen, right? That's the actual hole, right? This is where the actual food would be, right? Food, liquid, whatever it happens to be, this is where it would actually be, is here inside of the lumen, right? That's where it would actually be located. So we can see, right? Myenteric plexus, right? Submucosal plexus, right? As I had mentioned, right? These are the two groups of nerves which are going to make up, or which are going to regulate movement of the food through the GI tract. Now you can see that enteric nervous system, yeah, the enteric nervous system, right? This is part of the nervous system which regulates the digestive system, right? Which this is what regulates our GI tract, right? People sometimes call it like the second brain. The one thing about the enteric nervous system is it can and does function independent to that of the brain. Now, in saying that, right, that's not to say that the brain can't supersede it and affect it. It absolutely can. Right, so don't think, oh man, the enteric nervous system, it does what it wants, and the brain can't do anything about it. Not at all. I'm simply saying the enteric nervous system can function and does function without regulation from the brain. However, the brain can regulate the function of the enteric nervous system. Right, people, prime example, after death, right, the enteric nervous system actually still maintains a certain degree of function even after you're dead. Right, and the reason why, there's certain stretch receptor, there's certain neurons, certain tissues which are still actually functioning for a brief period of time post death. Right, as part of, well, we'll talk about that later on. I've got some images. We probably won't get to it in this video, but we'll talk a little bit more about that later on. So here is where we actually start to get into looking at kind of the GI tract, right? We're going to start way up in here at the mouth, right here. This is where we would actually insert the food, right? I don't know why I said that. Everybody knows, obviously, you put food in the mouth, generally. Some people, well, never mind. The oral cavity, right? This whole area through here, right? The oral cavity. Again, when you open up your mouth, right, to look into and you look into a mirror, that cavity that's there, again, the house inside of it, again, the lingual, the tonsils, or tonsils, tonsils, yes, but um, the um, the parotid gland, the submandibular gland, the sublingual gland, right, the tongue itself, those are all located within the oral cavity. Now, the hard palate and soft palate, yeah, if you take your tongue and kind of just push it upwards, right, it's kind of hard, right? The roof of the mouth is kind of hard. That's the hard palate. That's actually part of the maxilla or the maxillary bone. If you remember that thing way back from 121, right? I realize that many of you have had probably many nightmares of 121 and probably have lost a great deal of sleep. And hey, and you made it through, so congratulations. Now, the soft palate. The soft palate is posterior, or it's behind the hard palate. The hard palate is, again, it's the maxilla. It's this hard, bony feature. The soft palate, if you kind of touch your tongue to the roof of your mouth and then kind of start to draw it backwards, eventually you start to feel, or you start to run into a great deal of soft tissue. That's where the soft palate starts to form. Now, things with a soft palate, right? That dangly thing which hangs down. That's something called the uvula. This thing right here, that's something called the uvula. Now, the uvula, right? When we swallow, what actually happens? When we swallow, the tongue draws upwards and posteriorwards or backwards. And that causes the uvula to also shift backwards, and it closes off this opening. Right, let me get these arrows out of the way. Right. This opening, which we see right through here. Right. When we swallow, we don't want food to go from the oral cavity up into the nasal cavity. That sounds absolutely horrible. Well, that can happen, right? It's when you're young, even when you're old, somebody makes you laugh, sneeze, cough. I don't know how people make you sneeze or cough, but if they make you laugh, or if you sneezed or if you coughed with food in your mouth, sometimes that food can get up into and come out the nasal cavity, right? That can happen. Why does that happen? Oh, geez. Well, if we kind of think back, when we sneeze, when we cough, right, when we laugh, we increase intra-abdominal pressure. Oh my God, he's bringing up 121 stuff again. Yeah, if we think about our ability to, when we think about bearing down, or we think about coughing, right, just kind of poke the sides of your abdomen and cough, right? Just do it, right? What happens? Hopefully, you kind of feel your abdominal muscles tighten up a little bit. Yeah, because they're increasing the amount of pressure inside of the abdomen. Why? Well, the more pressure you build inside the abdomen, the greater the amount of pressure the air can escape this way, right? So if we, let's say, cough, sneeze, laugh, whatever it is when we have food in our mouth, well, sometimes if the food is, let's say, back here in this region here, if we cough or sneeze with enough pressure as that air is coming up, sometimes it can divert some of the food or liquid up into the nasal cavity, and we have milk, food, whatever it happens to be, coming out of our nose. So that's where it's not like it's a failure in the uvula, right? It's not like, the uvula, I've got a problem, I've got a lazy uvula. It's not so much that, right? It's just the fact that you've increased or created so much pressure, it just overtakes the strength of the uvula. Now, a couple other things, right? When we swallow, again, as I mentioned, the tongue draws posteriorwards and upwards, kind of obviously not that far, but in that direction. since that's where the tongue shifts, all of the food that was, let's say, in the mouth, all of that food gets pushed downwards and it gets pushed down into the pharynx. When it gets pushed down into the pharynx, something has to happen, right? If it didn't, well, yeah, hell, I got 2 tubes to choose. Like if I'm food, all right, I've got 1, and I've got 2. Huh? Which one am I going to choose? I don't know. Right? This one leads to the lungs. This one leads to the stomach. Right? Food doesn't care. Food's just going down some tube. Right? So there has to be something to divert, right, the food from going into the trachea, right? This air tube, our airway, right? Our windpipe, right? We don't want the food to enter into the trachea, right? This opening here, right? That opening is called the glottis. We don't want food to enter down into the glottis, right? This region right through here. Again, this is also where the vocal cords are. So we got to do something. There has to be something present, and there is something called the epiglottis, right? Epi around glottis. Oh, well, that's right. I just said this was the glottis. So if this is the glottis, the epiglottis, when we swallow, the epiglottis snaps shut over top of the glottis, and it closes it off. If this opening is closed, that means it's no longer an opening. So food has no choice but to go down the only open tube, and that's the esophagus. Woohoo! Right. When we talk about right the elderly, right, especially anybody can get a small amount of kind of liquid food potentially, but liquid kind of down into the this region here. Sorry, let me get the reds off. There we go. Right, this region here, and this is enough to stimulate a cough, right, a kind of a coughing fit, right. What commonly, right, because I kind of talk too fast. I drink, I don't know, a unsizable or a very questionable amount of coffee on a daily basis, and the fact that the haste that I consume it, I sometimes don't swallow it appropriately. I don't know. That's one of my problems. But anyways, see, I was actually just drinking more coffee. When right liquid starts to get down into here, that's going to stimulate a cough reflex. Why? Because we don't want food, we don't want water, we don't want liquid, we don't want anything not air to get down into the trachea. So that stimulates a cough reflex, and we propel whatever it is outwards. All right. All right. If somebody has swallowing issues, right? Elderly, stroke patients are a large, are a significant population of people who are not that they all have significant swallowing problems, but a number of them develop swallowing issues, right? Swallowing is a pretty complex task. It doesn't seem complex because you can swallow 1,000 times right in a row if you wanted to. But swallowing really involves a number of areas of the brain, right? Certain parts of the brain stem, certain parts of the cerebrum and the cortex. There's a large number of areas of the brain which are involved with swallowing. So it's one of those things which can be impacted. So my whole point is, if somebody has difficulty swallowing, right, they have some sort of impaired ability of swallowing. Perhaps the tongue doesn't draw posteriorward enough. Perhaps the epiglottis doesn't shift downwards like it's supposed to. If the epiglottis doesn't shift downwards like it's supposed to, that's where food can, or liquid can get down into the trachea. Or let's say if somebody vomited, right? Somebody vomited, right? And if they have swallowing issues, part of what can happen is some of that vomit can also get down into the trachea. And these are people can develop something called aspiration pneumonia, right? Because a food part, as they've aspirated something that shouldn't be, or they've gotten something which shouldn't be in the lungs, so hence aspiration, it begins to create an infection, then pneumonia. So, and aspiration pneumonia. So this here, and again, this is just the only slide I'm going to kind of talk about the teeth a little bit, right? But the teeth themselves, right? The previous slide we talked about swallowing and getting the food into the pharynx and the epiglottis, but how do we actually get the food to that point? First, we had to tear it off, right? Whatever it happened to be, right? The incisors, they kind of literally act like a pair of scissors, right? The incisors here, the front, and then here, right? The front four. Next are the canines, right? There's kind of sharp, pointy teeth. Those are the ones which really just kind of like rip and tear food off. That's their entire purpose. Next, we have premolars and molars. Again, those are the mortar and pestle of the food, or those are the mortar and pestle of the mouth. These are what really are going to kind of grind and pulverize the food. Now, you can see the uvula here. This is the structure right here that shifts when we swallow, shifts backwards and closes off this opening. Right, it closes off this opening, what's called the nasopharynx. It closes off this opening, so therefore food, liquid can't get up into the nasal cavity. Something else that's very important, right, is something called the frenulum, right? You look into a mirror, pick your tongue up, and you see this kind of thin band of tissue. That's something called the frenulum, specifically the lingual frenulum. Again, that limits the movement of the tongue posteriorly. Right, as I mentioned, right, when we swallow, the tongue shifts posteriorward, right? Well, we don't want that to happen so much that the tongue just like, shifts significantly posterior where it starts to get kind of not adhered, but it starts to get kind of hung up on it. It starts just, almost quote unquote swallowing your tongue, which again, that's not something you could actually do, but you can get the tongue far enough posteriorward where it does start to have quite a bit of difficulty getting it back anteriorward or back to its normal position. So the frenulum helps to limit that movement to posteriorward. Right, this is the frenulum right here. Right, again, it's something. I mean, for instance, this is one of the big issues. Let's say children who are tongue-tied. I say children, infants who are tongue-tied. Right, this creates a great deal of problems in infants, right? Especially if they're having nursing issues, right? Nursing or problems nursing. Um, our entire ability to kind of suck. Next time you have the Sonic near my house closed, and it broke my heart because they have the most amazing milkshakes, and these things are ridiculously thick. And when you suck on them, when anything, whatever it is, trying to suck, the milkshake or a thick milkshake through a straw, our ability to kind of increase or kind of have this suction force is drawn from our ability to move our tongue in the way that we do. Obviously, I can't demonstrate it. However, just next time you drink through a straw, now make sure it's not a plastic straw. Make sure it's like reusable or a paper straw, whatever it happens to be. Because you gotta save the whales, people. Save the turtles. Save the dolphins. All right. Anyways, but our ability for kind of suction, that's drawn from how we can move our actual tongue. So if Junior is tongue-tied, my son, he was tongue-tied, his frenulum was very shortened. He really couldn't stick his tongue out. He couldn't protrude his tongue or he couldn't stick his tongue out forward very much. So it really impeded his ability to kind of latch a hold of the nipple. Um, and again, it's really quite common in children and again infants. It is, I don't know. Recently, it's become a very big like plastic surgeon type of an ordeal. My son's pediatrician came into the hospital, saw it when he's tongue tied. He literally grabbed a pair of clamps, crushed the frenulum so the blood would stop flowing to it, and he literally took a pair of scissors and cut it. And my son cried for maybe 3 seconds. So yeah, I'm not really sure. It's not that big of a procedure, but man, it's becoming a pretty big ordeal nowadays. But anyways, that's the frenulum, that thing that prevents the tongue from moving too far posteriorward. So the tongue itself, right? We can see on the tongue itself, there's a number of different kind of bumps and kind of ridges that you see. Right? We look at this, right? These kind of large bumps that we see towards the posterior. Those are what are called circumvallate papillae. Circumvallate papillae. Here we can see the epiglottis. Again, that's the too far. Right here, that's the again that cartilage ring, that cartilage that's going to flap over top of the glottis, preventing any food from getting down into the trachea. Right. That's what we see here. But the circumvallate papillae, right? The papillae, there's a number of papillae. We're going to look at them actually here going forward, right? Even filiform, there's filiform, fungiform, circumvallate papillae. Right? The circumvallate papillae, they are definitely the largest. The papillae or the papillae, however you want to pronounce it, it doesn't really matter. Its primary means is to act as kind of like this friction pad, right? Think of tire treads, right? When the tires in your car are bald, right? When they are just like there's no tread left on them. You don't really grip the road very well. Your car kind of slips and slides around. Same exact thing would occur without the presence of these papillae on the tongue. The whole purpose of the tongue, well, the primary purpose of the tongue is when we eat food, it moves and mixes and propels that food from side to side and up and down, and it helps ensure that the food is actually mixed with all of this, the saliva. With the presence of these papillae, that ensures that there's some kind of gripper pad, if you will, which can actually, grab a hold of the food and have the ability to kind of mix it and mingle it around. Now we see here the filiform papillae, again, kind of tall and kind of wispy, right? You kind of see how they're kind of tall and pointy, right? Like this. Again, same thing, kind of tall and pointy. Again, those are the filiform papillae. The filiform papillae. Fungiform, very different. Right, the fungiform you can see. They're kind of large and almost like Mamacita. Good Lord. My ability to draw is just uncanny. Really, second to none. Solid work. Let's try this again. You can see the fungiform. Right, kind of this long, kind of round, drawn out feature, way different than filiform. Filiform, you can see, is just this kind of pointy, wispy, hair-like structure like this. Fungiform is very different, very kind of drawn out. Something else that we see on the fungiform is we see the presence of taste buds. Hey, taste buds. In the special senses, right? Our sense of taste or gustation, we talked about that. Remember, that's the other part of the function of saliva. Food, small food particles start to dissolve in the saliva. Right, as they dissolve, the little tiny chemicals that are rendered come into contact with the different taste receptors or gustatory receptors, and that's then transmitted back into the brain, and our brain decodes and says, oh, I'm tasting whatever, something, Snickers, or I'm tasting X, Y, or Z, whatever it happens to be. Right, I mentioned Snickers because when it comes to candy, when it comes to candy bars, I don't think there's anything that beats a Snickers. Maybe $100 grand. Maybe Baby Ruth, Butterfinger. All right, I guess I love them all. Anyways, we see another type of papillae that we see is something called the circumvallate papillae. The circumvallate papillae. Now, one of the big things with the circumvallate papillae, one, they're gigantic. Right? I say gigantic. Yeah, here, like this here, all these individual ones, these are the circumvallate papillae. They're massive. Right, the filiform and fungiform, you can see them kind of throughout here, but they're nowhere near the size. Right, you can see up here little small dots. Right, those are them. The circumvallate papillae are much bigger. If you've ever kind of gotten kind of red little bumps on your tongue and they're irritated, those are the papillae, which are getting red and kind of inflamed. All right. But one other thing about the circumvallate papillae, they have a huge number of taste buds. Huge. Right. They in and of themselves are large. Right. Very, very large. You can see the size of them. But they also have, you can see it over here, they have a huge number of taste buds. So that's one of the other ways to recognize these circumvallate papillae. So next, when we start to kind of talk a little bit about the digestion process. So our teeth act as this kind of grinder, this mortar and pestle, because the only way an enzyme can affect a chemical, or the only way an enzyme can work, or the only thing that the enzyme impacts is what it can touch or what it comes into contact with. So if I took saliva and dumped it over top of a giant cheeseburger, it's really not going to be very effective overall. But if I took that cheeseburger and I started to grind it up and pulverized it into this mush, right? That allows for a great deal of that saliva to actually come into contact with the food. So therefore, the different digestive enzymes, right, the amylase and the lingual lipase can actually start to, specifically the lipase starts to break down the fatty acid component. The amylase starts to break down the starch component of the food content, whatever it is that you're eating. Right. And the three glands. Right. We only see two of them here. The sublingual gland is inside the mouth. We'll look at it here in just a minute. Right. The parotid gland. Right. And for some reason earlier, I may not have said it. The sublingual gland is inside of the oral cavity. Earlier, when I mentioned it, I may have mentioned all three of them. I don't remember. But the parotid gland and the submandibular obviously are clearly not inside of the oral cavity. The sublingual is, to see that, we have to cut away like a large chunk of the face. That image is coming up here. But here's the parotid gland, right? If you kind of go to your ear, and if you go, I don't know, call it an inch forward, and then kind of go down, you feel this kind of small little soft bump, right? That's the parotid gland. It's something you can actually feel, right? That is the parotid gland, and it kind of makes sense with where it is. This muscle here, does anybody remember what this muscle is? I'm going to give you about 8 seconds. It's not worth anything. I can't see who is raising their hand. So I'm just going to assume everybody knows it. I hope nobody said the quadriceps femoris or anything like that. No, yeah, the masseter or the masseter, right? This is the muscle when you look into a mirror. Let's say you're chewing gum. You look into a mirror and you see these kind of muscles pop out on the side of your jaw or the side of your mandible. That's the masseter. Well, look where the parotid gland is. Yeah, it lies right on top of the masseter. Well, yeah. When we're chewing food, when I'm chewing food, that's when I need to have salivary secretion. That's when I need saliva in the mouth. Cool. So it just makes sense that the masseter, when I'm chewing food, the masseter gets big when I chew, and then it gets smaller. And then I chew again, it gets big, and then just look at it while you chew. Each time it swells up, it compresses the parotid gland, and guess what? It squeezes more saliva out of the parotid gland, and dumping it into the actual mouth itself. All right, so there's a reason why things are, again, this is not the first rodeo for you guys. There's a reason why things are anatomically established the way that they are. So this image here, right, this is of the sublingual gland, right? This is within the oral cavity. Take the tongue, lift it upwards, directly beneath it. That's where you see the sublingual gland. Again, sublingual, lingual being the tongue, sub being below it, so the sublingual gland right here. You can also see the parotid gland. You can also see the submandibular gland. They're definitely better seen here, right? Submandibular, right? Parotid. So now we're going to take a little histology or histological look at these different salivary glands. There's different types of salivary secretions, right? Some are a little bit thicker, some are a little bit more aqueous. The ones that are aqueous, right? Instead of saying watery, right? It's something called serous, right? And the parotid gland predominantly secretes a very serous, a very liquidy type of saliva. And it does so from what are called serous acini. All these things here, there's a 100 of them. I'm just circling some great examples of them. Right, these are all the individual acini, or acini, however you want to pronounce it. Again, there's many of them here. I'm just circling some of them. Right, those are all serous acini. Right, another one there. Right, they're all over the place. All over the place. These are going to produce serous salivary secretion, or very liquidy or very aqueous saliva. That's different than the sublingual salivary gland, right? They contain acini as well, however, they contain mucus acini, or acini, right? You can see right here again. Just like we saw, just like with the serous, how I circled a bunch of them. Same thing here, right? There's mucus acini, however you want to pronounce it. Again, I'm just circling some of them. Again, mucus acini. It's a much thicker salivary secretion than the parotid gland, right? That's the sublingual gland. Sublingual gland produces a very thick, mucousy saliva. The submandibular gland produces a combination of the two, right? When we look at this, here we see serous acini, but yet we also see mucus acini. And that's something that you would see in the submandibular gland. You see the presence of both of these acini. Right, so again, these here are serous acini, and these here are mucus acini. Right, and that's the thing. On the exam, right, I'll definitely, whatever. If I show you this image, I might ask you, if I might just ask you the specific structure. I might have an arrow pointing to this and say, identify that structure. So you would tell me mucus acini. I could just show you this image and ask you, tell me what gland is seen here. So you would have to write submandibular gland, right? Or let's say if I showed this, showed you this image, and then if I had a picture of a torso and told you to place an X on the, or torso, excuse me. Let's just say if I showed you this picture and then had the choices of, a face and in the location of the submandibular, sublingual, and the parotid gland, I put an A, B, and C. You would select, which one of, which location is this gland located in. Right, so there's a number of different ways I can kind of ask questions from this. The tooth, right? Again, I covered these briefly as far as the orientation, the different type of teeth. Here's just a couple of the small structures, right? The enamel kind of protects the tooth from wear and tear. Unbelievably hard stuff, right? This is what we, the kind of the white part of the tooth. This is really what we, brush our teeth, cleanse off the bacteria to try and strengthen the enamel, right? This is where we talk about the different problems that arise from acids or from kind of chronic sugar consumption, right? Especially people who, let's say, for instance, drink like sugared coffee, or people who add sugar to their tea, or people who eat candy throughout the day, right? The reason why I specified sugared coffee or sugared tea, for instance, is because generally coffee is consumed over a long period of time. Same thing with tea. So if it's sugared, you're just constantly reintroducing a new, fresh source of glucose for the bacteria in the mouth to ferment. As the bacteria ferments that sugar, it produces acid, and then acid can erode the enamel. That's the problem. Right? Deep to the enamel, where we see dentin, calcified connective tissue makes up the majority of the tooth. Yeah, all this through here. This is all dentin. Come on, mouse, don't let me down. There we go. This is all dentin. Now, deep to that, this is where we start to get into where, right? You can let's say for instance the cavity, having some sort of carry down this far. You can start. You don't have to be into the actual cavity itself for the nerve, for the to be. Ooh, my tooth is kind of sensitive or painful. It doesn't have to be all the way down, but I mean it's it can it needs to start to enter into the kind of into the dentin for there start to be some kind of sensitivity which you're feeling, right? Now, down here again, this is all this what we call the pulp cavity, right? Down and through here. Now we talk about a root canal, right? We've all heard of a root canal before, right? This is where whatever I'm dying, my tooth is killing me, or there's some sort of dental carie or cavity which has made its way down into the pulp cavity. When that happens, we've got to do something. So with a root canal, we just that's a drill. Hope you like my drill. That's a good drill, right? But no, with the root canal, right? That's essentially where they come in here, and essentially do just that. They destroy the canal, right? So therefore, if destroying the actual kind of nerve in that travels through that canal, not only destroy that, there's no nerve present, but that means there's no pain that can be present, right? So that helps to eliminate the pain. Now, some other things which are going to hold the tooth in place, something called cementum, right? Think of it as like tooth cement. We see bone-like substance that attaches the root to the periodontal ligament. The periodontal ligament, that's this all, right? This here, 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 here. That helps to hold the tooth into the socket, right? People who have periodontitis, right? These are the I'm from way upstate New York, and some of my distant family members, right? They certainly suffer from a great deal of periodontitis, right? They've got maybe a couple of teeth in their head, and they're proud of it, and that's hey, you know what? I love where I'm from, right? People are fantastic. But dental hygiene is nowhere near the top of the list. In fact, it's not even on the list. It's not even a word. Like, the hell's dental hygiene? I've never heard of this thing before. So the periodontal ligament it kind of suffers. And when that happens, when the periodontal ligament gets irritated, that's where we have periodontitis. And the periodontal ligament starts to weaken. If it starts to weaken, well, what happens when an anchor becomes weak, or what happens when a rope gets weak, it breaks. So as the periodontal ligaments begin to rupture, the tooth itself begins to kind of wiggle, and then eventually it will fall out. One other thing, the gingiva, right? We talk about the gums, right? Our gum, just the more, colloquially we call it the gum, but the gingiva, where we talk about gingivitis, right? That's where there's irritation, inflammation of the actual gingiva or the gums themselves. They become red, irritated. They start to even pull away from the tooth a little bit because of the irritation, right? So at this point, we've gotten through cutting off of the food, right? We've bitten the food off. We've got it in the mouth. We are then going to take that food and swallow it. So the tongue draws posteriorward. When that happens, the uvula closes off this opening, and that food then travels down into the esophagus. The next video is where we're going to start to pick up on when that food actually leaves, right? Or what that food has now left the, right? It's left the oral cavity. It has left the pharynx. It has passed through the larynx. Now it is on, or through the area of the larynx, and now it's on its way to the esophagus en route to the stomach. That's where the next video is going to pick up.